Okay, so you're a new parent, and your world pretty much revolves around keeping your tiny new person happy and healthy. But, during those first few doctor visits, you're probably going to hear about one simple but absolutely crucial nutrient. So let's get into it. Let's talk about why vitamin D3 is so important for your newborn. It's a question pretty much every new parent asks. Your baby seems perfect, they're eating well, so why do they need daily vitamin D3 drops? Well, the answer isn't about fixing something that's wrong with their diet. It's about proactively filling a completely natural gap. And the reason for those drops, well, it really comes down to what you could call a hidden problem. It's this natural nutritional gap that exists even for the healthiest, most well cared for babies. And it's something every parent really should know about. Here's the core of it. Newborns are just born with low levels of vitamin D. And it's so important to understand this has nothing to do with your care. It's just the biological starting line for all infants. It's a totally normal situation, but it's one we need to address. So you might be thinking, well, what about the natural sources? Like sunlight and mother's milk. But here's the surprising part. They're just not enough. A newborn's skin is way too delicate for the amount of direct sun they'd need. And even mother's milk, which is liquid gold, doesn't have the high concentration of vitamin D that a rapidly growing baby needs. Right, so if the natural sources don't quite cut it, how do we fill that gap? This is exactly where vitamin D3 comes into the picture. The best way to think about it is as the essential building block that nature just needs a little help delivering in those crucial first few months. So what's its superpower? Well, vitamin D3 is basically the key that unlocks calcium absorption in the body. Without enough of it, the calcium in your baby's diet can't really be used effectively to build those strong bones and teeth. And this whole absorption thing, it kicks off a really powerful chain reaction. It lets the body grab onto calcium, which then gets put to work strengthening bones and supporting healthy teeth development. Both of those things are totally dependent on that first step, actually absorbing the calcium. And that's all powered by vitamin D3. So because of this natural deficit and the absolutely critical job that vitamin D3 does, the entire medical community has a very clear and unified recommendation for all new parents. And the recommendation is simple and consistent. Doctors strongly advise giving vitamin D3 drops to newborns. This is just a standard, super safe, and really effective way to guarantee your baby is getting this vital nutrient right from the very beginning. All of this really presents a clear choice, two different paths for your baby's development. And following this one piece of advice is the key to making sure they start off on the right one. And this lays it out perfectly. With enough vitamin D3, you are directly supporting strong bones and healthy development all around. But if there's a deficiency, you're introducing a risk of bone weakness, and that can lead to some serious issues down the road. That risk actually has a name: rickets. It's a condition where a child's bones can become soft and weak, all because of a long-term lack of vitamin D. Now, that sounds pretty scary, but here's the most important part. It is completely preventable. So here's the main takeaway. This isn't just some casual suggestion. It's a medical directive. It's designed to prevent problems before they can even start, and to make sure your child has the best possible foundation for healthy growth. Ultimately, that one simple drop of vitamin D3 is one of the very first and most important things you can do to build a strong, healthy future for your child. It's such a small action, but it has a massive impact. So the real question is, are you laying that strong foundation?